Mr. President, I rise to join this debate today, and I certainly respect the senator from Missouri for his views and for his own interpretation of what he thinks his amendment does. But I couldn't disagree more on what the amendment says, what the amendment will do, and what the process has been for us to get to this point. I mean, we're down here, and I know my own office, myself, my focus is on our economy and getting our country moving again and focusing on jobs. And so when I see a transportation bill that is now mired in this debate, I ask myself, how much more time are we going to waste debating and redebating an issue that we've been debating? I know that some people think that this is an important debate related to transportation, but it seems as if the other side of the aisle, in all the discussions we've been having for the last year about jobs, about appropriations bills, about the debt ceiling, about moving forward on reconciliation, all come down to one thing. Let's get rid of reproductive health care for women. In February of last year, they introduced a bill, H.R. 1. They said, let's defund Planned Parenthood. Then later in April came a big moment of, are we going to move forward with a continuing resolution? And it was all brought to a halt until we could have a vote on defunding Planned Parenthood. And then we had another vote on it in the latest discussions about the payroll deal. There was discussions about whether a rider was going to be in there that cut women's reproductive health care access. And appropriations bills just last December, same issue. Every step of the way, it seems as if there is an assault on women's reproductive choice and having access to health care. So I know my colleague from Missouri thinks that this issue might just be about something the administration's done in the health care bill, but his party is making everybody in America believe that we can't get our economy going and balance our budget and deal with our deficit unless we defund women's health care choices. And nothing could be more incorrect about that logic. We are holding up the business of America just for these votes on basically curtailing rights to access that women already have. So, Mr. President, it's so frustrating to think that we would be going backwards on this. And I applaud the chair of the Transportation Committee because she's worked hard on this legislation. It's 30,000 jobs in the state of Washington by the Department of Transportation's estimates. I know it's going to help save about 1.8 million jobs and create another million jobs on a national basis. And so I certainly want to get to the job at hand. And when I think about the 435,000 Washington women who would be affected by the Blunt Amendment by curtailing their access to health care, and while some people think it's about contraceptives, which it is about that, but it's also about breast cancer screening, and we have one of the highest rates of breast cancer in the country, so we want to make sure that we get those screenings done, about wellness exams, about diabetes screening, about flu shots, about vaccination, about mammograms, about cholesterol. We're having this debate today, instead of talking about transportation infrastructure, about defunding these vital programs. Now, the reason why I say this is so important to us and so important to us in Washington State is because we've been having this debate. We've been having this debate since almost, I think, 2001, 2002, on the Bartell drug decision. And so my colleague who says that, well, these businesses wouldn't dare do anything based on cost under my amendment, I think all he has to do is look at the federal cases that were brought against major employers like Walmart, like Bartell's, like Diamond Chrysler, and other organizations who weren't providing full reproductive choice for women and discriminating against them in their health care benefits. And a federal law, a federal statute was used to say that these practices were discriminatory. So the same debate we're having here today has played out in state after state. In our state, the Bartell drug decision. And in that decision, the courts have found that you cannot use these principles to discriminate. It is a violation of the Civil Rights Clause. And so while I know my colleague thinks that this is a new debate, it's not a new debate. It's a debate that has been had in America among states, and courts have used federal statutes to protect the rights of women. So now I see that we're going to have this debate today, and I ask my colleagues, how many more times this year are we going to interrupt the business of the Congress on things like transportation, on infrastructure, to have a debate that has already been settled? And I know my colleague thinks that the amendment is very narrowly written. It's not. I don't think that's the interpretation of any legal mind, that it is narrowly written. It will affect and give employers the right that courts have already said they don't have the right to discriminate. It will reopen the cases of those large employers who have already been found against and say to them, yes, you can come up with a reason and curtail access to preventive health care for women that is so needed at this time. So I ask my colleagues to turn down this amendment, and I ask my colleagues on the other side of the aisle, let's get at the business at hand and focusing on our economy, focusing on jobs, and stop making women's health care a scapegoat for what you think is wrong with America. It's actually what's right with America, and let's focus on jobs. Thank the President, and I yield the floor.